Assalamualaikum and hi to everyone and also to our respected lecturer Aida Shalini. So today our group will present about causes and effect of mental health issue among Malaysian students. I will introduce my team members. First we have AYADI ZULFADHLI. Second we have HARITH. Third me Muhammad Afif. Fourth NAZIRUL HAKIM. And last but not least we have MOHAMAD HAQQI. On this slide, we will discuss 4 main points. First, financial issues. Second, academic matters. Third, bad academic performance. And lastly, student health deterioration. Mental health issue has become a serious problem among Malaysian students nowadays. But what actually a mental health issue? The definition of mental health, also known as mental health disorder, refer to a wide range of mental health conditions characterized by disturbance in mood, thinking, and behavior. Depression, anxiety disorder, schizophrenia, eating disorder, and addictive behavior are all examples of mental illness. So, the classification of mental illness, we have bipolar-related disorder, depressive disorder, trauma and stressor-related disorder, sleep-wake disorder. So, for example of this classification, we have involved intense mood swing, shifting from manic episode to depressive episode without any single warning. Second, we have feeling of sadness and tearfulness. They lose of interest in all normal activities such as sport. And last but not least, they have trouble in thinking normally. So, for the causes and the effect, we have financial issues, academic matters, deterioration of mental and physical health, negative impact on academic performance. I will pass this presentation to the next presenter.
So I'll continue the presentation by presenting the first causes, which is a financial issue. So let's look at the definition of financial issue. Financial issue is a problem where people worry about their money and can cause their mental health situation. Students have been facing financial issues lately, and this issue has become one of their major problems. Most students will experience financial issues, and worrying about their payment for their courses at university can increase their mental health condition such as depression and stress and anxiety. Students also usually spend more than how much they earn because they do not know how to distribute their money well in daily life. Once the students are facing a money problem, they could not focus on their studies, which will impact their academic performance and also will affect their future when finding jobs. Usually, students don't really plan it well for the future use of money, which can help them to buy books instead of spending the money in the wrong way. This is the example code that can relate with these financial issues causes, which is being in control of your finance is a great stress reliever. Next, we continue with the second causes, which is the academic matter.
Assalamualaikum and hi, my name is Muhammad Harith bin Muhammad Kamal. So I'm gonna talk about academic matter which cause mental health to students in Malaysia. So my first point is examination. I'm sure everyone know what examination is, right? So research show that 44.1% from 450 students are stressed because of exam. It has become a norm for students who haven't fully prepared for the exam to become panic and stay up and then study last minute. It has become a norm for students who haven't fully prepared for this exam to become panic and then stay up and study last minute. So stay up can be divided by 3. First, they sleep just for 2 hours. Second, they sleep for 2 hours early and then wake up until tomorrow to study for the exam. And the last one, they simply don't sleep. which also will make their condition worse than before. Different case for those who already studied for the exam but still cannot answer this question. This also will make them stress and think about their failure for a long time. Then my second point is lecture hall condition. Again, research show that 163 students are stressed because of hot lecture room. Also, noise disturbance from outside, which can make them stressed also because they cannot hear what the lecturer said. Both of these can make students less focused in class, which will make their study for exam harder than before. So, we go for the third point, which is course choices. Why I'm saying this is the cause? Because some students choose the course not based on their interest of capability, but they're more likely to follow their friends so they can be together in the university. Last, high expectation. This happened to the final year students. They need to go out graduate with a good grade result, of course. So they might push themselves too hard to study for their final exam. Before we finish, I want to add another one which happened to first year students. When they just enter the university, they cannot adapt to university system and environment in university, which will also make them stressed with no reason. And for the first year student, they might not have any contact for the senior, so they will be stressed alone, and it will be more worried than people who stress in exam.
Okay, next is I'll be presenting about the effects of mental health issue towards the students, which is bad academic performance. Okay, next is regarding on the reasons why mental health issue affects their academic performance badly. So firstly, I will talk about the anxiety. Likewise, this mental health issue like anxiety, for example, makes the students become more reluctant to seek help from others regarding their studies, whether it is from their peers or their teachers, which make the issue more concerning as they will be left behind on their studies when compared to their peers. So next, regarding on the anxiety, these anxious students may have difficulty attending lectures or seminars or managing the social relationship that come with everyday college life. So this often found to have negative impact on school attendance. Students with mental health problems may suddenly change their level of participation or appear less active during class or any activities that they usually participate in. So next is about lack of focus. So mental health issue frequently affects student academic involvement and attentiveness, which can directly affect their achievements. So students struggling with mental health may see their grades drop or struggle to meet the high demands of tests and assignments because they cannot focus on their academic, whether it is during lecture or during their self-studies. Besides, this also can be linked to high dropout rates because of mental health problems. So every institution should strive to ensure that interventions are completed in a timely manner to prevent students from dropping out of a course due to mental health issues.
Hi, Assalamualaikum. My name is MUHAMAD HAKIM. So I will proceed this presentation with the second effect of mental health issues among Malaysian students, which is deterioration of student health. Okay, students' health can be classified by two categories, which are mental and physical. mental health issue, of course, may affect the mental health of the students, where people who are suffering from mental health will show various symptoms such as little or no energy, pushing away people, pulling themselves back from regular activities, loss of sleep or will to eat, smoking, drinking or doing drugs, feeling helpless, yelling, loss of temper, and many more. In the long term, the possibility of that person to commit suicide is very high. Next category is physical health. Actually, mental health problems typically do not cause physical symptoms in and of themselves. However, depression can indirectly cause it. For example, lose weight, or maybe some of person that going through depression will gain weight and become obesity, or sometimes it is caused any disease due to smoking or alcohol consumption and many more. This is because our body and minds are not separate. So it is not surprising that mental ill health can affect our body. So these are a few examples related to this issue, which is self-injury, where the person who has poor mental health will lose their rationality to think and will think they are useless or something bad, and will harm themselves, and sometimes will commit to suicide. Next, drunk or over-consuming alcohol and doing drugs, where some people think this is the way to relieve their stress, but actually this behavior will make their health getting worse. After that, no energy and not enough sleep, where the person going through poor mental health will keep thinking of their problem and not get enough sleep or insomnia. Moreover, obesity. This is because they think they may reduce their stress or depression by eating. Or some people will lose weight due to they lost will to eat. Lastly, easy to get sick. This is because poor emotional health can also weaken our body's immune systems. So it is easy to get colds and other infections during emotionally difficult times. Also, when feeling stressed, anxious, or upset, we may not take care about our health as well as we should. So we may not want to exercise or eat nutritious food or take medication prescribed by a doctor. So I think that's all from me. Thank you.
So, for the conclusion, the importance of knowing what is mental health issue can help the community to develop a connection with the one who suffer instead of leaving them alone. We absolutely agree that mental health issues still become a menace among Malaysian students based on the discussion about its causes and effect. Increased self-injuries behavior among Malaysian students is one of the reasons that mental health issues should get rid from them. The effective action should be tried even if it takes much time in order to reduce the mental health issue. For an example, counseling session. And lastly, our future generation is the important factor to make our country become stable in economic and politics. So that's all from our group. Thank you.